The following content is for entertainment and educational purposes only. It does not constitute means for diagnosis, healthcare advice, nor treatment. Make use of a qualified healthcare professional for such purposes.
Good afternoon. My name is Dr. Snow White, and I am a pre-licensed counselor. And what does that mean? It means that I have to be supervised for the type of work that I do. The first supervisor that I have, his name is Dr. Peter Pan, and he is a licensed psychologist here in our state. And I also have a secondary supervisor. Her name is Dr. Cinderella, and she's also a licensed psychologist here in the state of Alabama. So one of the things that I'd like to discuss with you is your patient rights, and you are protected both by federal and state laws. One of your patient rights is that I'm not allowed to share any sort of information that could identify you. So the information that you have here cannot be shared with anybody else, okay? So I do have to keep that confidential and secret for you. If you're under and above, I should say, the age of 14, I would need your written consent. So for instance, if you wanted me to talk to your psychiatrist or your employer or somebody like that, I would need express written permission in order for me to break confidentiality. There are some limits to that though. So for example, if you pose to be a liable and viable threat to yourself, meaning that you will kill yourself or that you will kill another person, you and I are going to work together to de-escalate that situation. If I am unable to reduce the chances that that can occur, then that is an instance that I would have to break confidentiality and get in people that can help us keep you safe. There's another limit to that confidentiality, of course, and that is if there is a child or an elderly individual or a vulnerable person that is at risk of sexual or physical assault in our particular state. That would be anybody under the age of 19 or any person above the age of 64. And that is something that I cannot keep confidential. Do you have any questions for me about anything I just mentioned? All right. So today, we are going to talk about your initial assessment. So what is our objective today? My objective here is to get to know you, right? To get to know things like your background, family history, things about maybe some issues that you may be having, maybe some stuff about your school or your work. So basically, I'm trying to get to know you. The better that I get to know you, the easier it's going to be for us later on in treatment so that I can help you. So you're going to find that I'm going to ask you a lot of questions. They're very similar to the form that you filled out before we started. So basically a lot of information about symptoms, your background, your strengths, your goals that you have here in therapy. So I don't want you to think that there is a right answer or correct answer. There isn't a correct answer. To me, the best answer is an honest answer. Okay. And like I said, I can't share this information with anybody else. So do you have any questions? Okay. So like I said, it's really short questions. You don't have to elaborate in any of the questions. So just use the best answer that you have for that question. Okay. So let's start with the very basic information. If I were to ask you to tell me in one sentence what brings you here today, what would you tell me?
My husband is an alcoholic, and I have been depressed trying to keep our relationship together.
Okay. very sorry to hear that. That's really challenging for you right now. But I am happy to help you with that if that's your goal here in session. Okay, so in upcoming sessions, I will be more than glad to help you with that. And I'm happy you paid me a visit today. All right. Tell me, what kind of things have you noticed in your relationship right now? Tell me about how long has this been occurring? Tell me about, say, for example, when did it start? What can you tell me?
Well, we've been together for 6 years, and he has drank that entire time.
Okay.
I feel like it has gotten more in the past 6 months. It's gotten worse. He's been drinking more, and he's become a lot more verbally and even sometimes physically abusive.
Okay. What can you tell me about this abuse? And it's okay if you can't answer a question right now if you're not ready for that.
The verbal abuse is like, well, he sometimes accuses me of like cheating on him if I'm 5 minutes late from work. Like, oh, you must have been with another man. Who would want you? You're ugly. You're lazy. The physical abuse is when he comes home drunk and he starts in on me, and I'm like, stop. I'm not cheating on you or whatever. And he hasn't hit me in the face, so I guess it's not really physical abuse, but he pushed me up against the wall one day and held me up against the wall.
Okay. How would you describe physical abuse to me?
I guess just like if he hit me.
Okay. Okay. What is hitting to you? What would that be? So, for example, he punched, a slap.
I would say a slap or a punch would be.
Okay. Do you consider your life to be in danger?
No.
Do you guys have any pending separation? Have you guys separated before? How long have you guys been married?
Never. We've been married 6 years.
And you said that situations got worse about 6 months ago. What was different 6 months ago? What
He
changed?
wasn't so verbally abusive, and when I came in here because he held me up against the wall, and that was scary.
Okay. Tell me about this feeling of fear that you felt scared. Tell me a little bit more about that.
I felt like maybe he was going to hit me, but he didn't, and so that made me scared that he could possibly hurt me.
Okay. I'm going to ask you a couple of questions as to how we're dealing with this specific situation. And again, the best answer is an honest answer. Okay, so I want you to think really hard if any of these characteristics sound like something that's happening. Okay, let's talk a little bit about emotional characteristics. Are you feeling anger? Are you feeling bitterness, I should say, guilt, sadness? How are we feeling right now with this concern?
I'm feeling definite sadness because I'm not happy in the relationship right now, but I was happy and I love him and I want to make it work. So I kind of feel discouraged.
Okay. What about feelings of yearning?
I yearn for him to stop drinking.
Something about that is the good thing is that you and I are here, right? And that's something that we can work on the feelings that you're experiencing with him. However, he's not here with us today. So it would be a little bit difficult to accomplish that type of goal because he's not here with us. But the good thing is that you are here and I can help you navigate this situation if you wish to do so. Okay. Tell me about anger, guilt, any other feelings that you may be having because of this concern.
Well, I feel inadequate. I feel like, what is wrong with me that he would treat me like this? And I think he may be cheating on me, and that's why he's accusing me of doing it.
What does feeling inadequate mean to you?
I don't feel good enough for him, that he would have to look for it in someone else.
Look for what?
Whatever makes him happy.
Let's talk about anything physical that relates to your current situation. So let's talk about, do you experience any headaches because of this situation, chest pains, you feel digestive problems, for example, having diarrhea or vomiting, any sort of physical characteristics that are coming with this issue?
So it's affecting my sleep. I'm not eating as much. So I would say it's affecting my appetite. I've been kind of excessively working out. I'm really, that's how I cope, and I feel like it helps me. Plus, I feel like maybe I'm overweight and I need to lose weight, and that might be what's made him turn to someone else.
Have you talked to a physician about excessively working out, or does that mean to work out excessively?
I do it like 2 times a day, every day.
Okay.
And sometimes I just push myself way too hard to where I'm not feeling well because I'm not eating a lot also.
Does that lead you to any digestive problems?
Yes, I already had IBS, but I think it's made it worse.
Okay. We're also going to talk a little bit about your medical history too. So if you think there's anything there that you would like to share with me, I would appreciate that too, for sure. Tell me about any changes in your behavior because of this concern. So for example, you have become more isolated and withdrawn, you have lost interest in things that you like to do. What would you tell me?
Yeah, all of that. I mean, I don't see my family as often as I used to. I don't go out with friends ever because he always accuses me of doing something if I go out with friends. And it usually leads to a fight when I get home. I don't know. I feel like I just used to be like a happier, more joyful. I used to laugh and joke, and I feel like that's gone. It's harder for me to, I'm just naturally more serious now.
Do you think there's anything that we might have missed in regards to this new change of adjusting with the increase of, as you explained it, abuse from your husband? Anything that you think, you know what, this is important, I think I should mention that. Well, thank you for sharing that with me. I appreciate it. This is usually the hardest step, is to come to the office for the first time and share how you feel. So I'll have you know that you are doing one of the hardest things, and it's nice for you to share that, and I really appreciate it.
It was hard for me because he doesn't know that.
Well, like I said, I can't share your information with anybody unless that you pose a serious threat to yourself, another person, and we can de-escalate, or the physical or sexual abuse of a minor or an elderly person, which here in our state we define as a person of 64, I should say, years of age. Tell me about any other concerns. So for example, depression, anxiety, having issues with grief, eating disorders, anything that you say, you know what, I struggle with that, or this is really complicated for me. What would you tell me?
I've always had anxiety, just generalized anxiety. I used to be on medication for that.
Okay.
Um,
When you say always, when did you receive a formal diagnosis for anxiety?
Yes.
Okay. How old were
that
you?
was when I was in high school.
Okay. What happened then that led to seeking that type of help for a diagnosis?
Well, my home life just wasn't good. My mom and dad fought all the time. He had multiple affairs on my mom.
Well, anxiety looks different from one person to the next, right? So for example, some people may become, say, a little bit more isolated. Some people may start becoming restless. So help me understand what anxiety feels and looks like to you.
It's kind of like I have a short fuse. I'm very more irritable.
Okay.
We have a daughter, and I'm definitely more impatient and short with the daughter.
Tell me about any other characteristics. So for example, becoming confused, say trying to avoid certain things, having difficulty breathing, any other characteristics that you can share with me?
I think I had an anxiety attack maybe 2 weeks ago.
Okay.
I just felt really overwhelmed. My heart started racing. I started breathing heavy. I felt like an elephant was sitting on my chest.
Okay.
and I kind of just lost it and cried for about 15 minutes, and then I felt better.
Okay. Is that typical? Has that happened before?
I remember my last one was like in college, I think.
Okay. What was different 2 weeks ago?
I think I became really overwhelmed with just his actions and his drinking. It was a day he had been at work, and he came home already drunk. And so it's like, I don't know if he's drinking at work or during the day while he's at work. He works till late, most days. And then he came home later and he was already drunk. So I don't know if he stopped at the bar after or what, but he came in just like complaining about the house not being clean, complaining about the laundry not being done. And I work also, so I just hadn't had time to do it. He complained about my cooking, so that's when I had to panic.
What was different in college? You say that it hadn't happened since college.
It was my senior year, and I was just overwhelmed with trying to find a job, the change, passing boards, all of that.
Okay. Good deal. We're actually going to talk a little bit about your education as well, so I'd like to hear more about your background for sure. Tell me, how many times a day do you consider to feel anxious? So does it happen multiple times a day? Does it happen daily? Maybe a couple times every week? Pretty rare.
I would say daily for sure.
Daily. Okay. When do you have any triggers that you might have identified before? When do you usually feel more anxiety?
My triggers are like just noise, like if my kid's being too loud or too hyperactive and banging pots and pans, just loud noise really triggers it.
Okay.
And then her just not listening.
You said you were how old when these attacks, as you described them, happened?
How old? I think that was maybe like 14.
Okay. You did say that you've been treated for generalized anxiety. What does treatment mean?
I saw a doctor. They put me on anxiety medication.
Okay. Did you receive any therapy for that? No. So psychotropic, so medication geared towards psychological disorders. Okay. If I were to ask you to rate anxiety today, right? Not because you're seeing me, because I'm a sweetheart, but if I were to ask you in regards to how complicated or how severe do you consider anxiety to be for you? So for example, is not so bad, so and so, or it does impact me a lot. Which one would you pick?
I would say moderately.
Okay.
I think it's affecting my parenting. Like I said, I haven't been the mom I want to be because I've been short with my daughter and impatient.
So we talked about marriage. We talked about anxiety. Is there anything else that you think, you know what, this is something that I would like to discuss? Okay, and if something comes back to you, you can always let me know. Okay. So then, oh man, I wish I could talk about that. Or if you're not ready for it, yes, that's okay. All right, because we can't talk about it. Good. Well, thank you for sharing that. Let's talk a little bit about your past history. I know that you mentioned earlier that you have received treatment for anxiety. Have you ever been to therapy for other concerns or received any sort of medication for anything else? Okay. Have you ever been to the hospital or a clinic because of any psychological concern in the past? Okay, good deal. Whenever you are prescribed medication, do you usually comply with the treatment, or is it difficult for you to comply with treatment? Okay, good deal. So you take the medication as prescribed,
Yes.
more or less at the time you're supposed to take it. Perfect. All right. Have you ever assaulted anyone?
No, never.
Okay, so no fights, anything like that. Okay. Good deal. And any issues, for example, when at school or younger or today, so for example, you have this story property, you ran away, you had some sexual promiscuity, for example, having risky sex or truancy, anything like that whatsoever.
No, if anything, I was the good girl. I was a
Okay.
rule follower, perfectionist, yeah,
Okay, what does it mean to be the good girl?
everything. All the rules.
So now we're going to talk a little bit about your medical history, and you're wondering, why is it that I have to talk about medical history if I'm here for some mental health concerns? Well, the reason is because anything physical is going to have an impact in our psychological and emotional state. So for instance, if you suffer from back pain, for example, maybe if you suffer from back pain, you don't want to come to therapy because it's really painful to you. So that could affect how you adhere to treatment, for example. Or for instance, if you have a deficiency, right, a vitamin D deficiency, which we know by research that it can impact depression. So notice that there's always something physical that we should look into when it comes to mental health. So having said that, I do see you wear glasses. Do they work well for you? Do you need something else in order to see correctly? What can you tell me?
No, my glasses are great.
Okay.
I have a mild prescription, so.
Okay. Good deal. Good deal. So they work just fine. Okay. Good deal. Any issues, for example, with your teeth, with dental infections, pain, anything like that?
No, my biggest issue has been my IBS. Yeah.
Okay. What can you tell me about IBS?
I am constipated a lot. It's hard for me to go.
Are you currently receiving treatment, medical treatment for that?
I saw, and I have acid reflux also,
Okay.
which goes along with that. But I saw a gastroenterologist, and they did an endoscopy and didn't see anything. So
Okay. So how are you managing that?
I just take Tums.
Okay. How's that going?
So like sometimes that helps, but I just wish I could fix the overall problem of it.
Okay. What is the overall problem?
Of having to take Tums every day because I'm getting acid reflux no matter what I eat.
So as you know, I'm not a medical provider, so I really can't give you any sort of medical advice in regards to anything on that aspect. But my job is also to look out for your best interest. So if you consider that, maybe I need to check out and talk to a physician about this, then if you think that's in your best interest, then that's something that you could address. Okay. Any sort of, let's talk about surgical history, minor surgery, major surgery, anything like that.
No.
Getting your teeth pulled, anything whatsoever.
Yeah, I got my wisdom teeth cut out when I
Okay.
was 17.
Okay. Can you tell me about that surgery?
I don't remember a lot of it. I mean, it went well.
It went well. Okay. Good deal. Good deal. Any history of, for example, an accident, hitting your head, losing consciousness, anything whatsoever? Okay.
Never had a car accident.
Okay. Good deal. Do you smoke? Okay. Any history of smoking? Okay. Good. Any other diagnoses that you think other than IBS and anything else whatsoever? What would you tell me? So a good deal other than okay. Good deal. Let's talk a little bit about your social history. So now we're going to look into your background, and we're going to start from the very beginning. Where were you born?
I was born in Michigan.
In Michigan. So what brings you down here?
A job.
Job. How was that transition?
It's okay. I'm closer to family, so that's nice.
Okay, so who's down here?
My mom lived down here.
Okay. How's that going?
It's good. I mean, I miss her. Like I said, I don't get to see her much anymore, so it was nice at first, but now I feel like she's so.
If I were to ask you who raised you, what would you tell me?
I know.
Just mom? What was that?
I mean, he was there, but they fought all the time. I mean, he didn't have much to do with us kids, so.
Okay. Right. When you say they fought all the time, what does that mean?
or they would just scream and he would leave. He'd be gone for a week or two and then come back.
Tell me a little bit more about your siblings, right? Are you the oldest, the youngest? What would you tell me?
I'm the youngest.
Out of how many?
Two.
Two, okay. So I'm going to give you a couple of terms, and I want you to pick one that best describes your child, okay? So the first one is never abused. The second one is supportive and intact. The third one is dysfunctional. The fourth one is chaotic. The fifth one is prolonged separation. And the last one is abusive. Which one would you pick to describe your childhood?
Chaotic.
Okay, what makes it chaotic?
The fighting. Constant fighting. Constant back and forth with my dad being home or being gone. But my mom was very loving and nurturing. So I feel like she tried to overcompensate for that.
What does it mean that she's trying to overcompensate for that?
I think she kind of let us smile with too much. So she was kind of trying to be kind of lenient, trying to be. She's also gotten better since dad was out of the picture. So.
Okay. What does it mean that she got better?
She's happier, and she tries to give us more like sound advice and like be more of a parent than a friend.
Where's Dad now? Where's Dad?
I don't know.
When you say that Dad left, when did he leave?
17.
And you don't keep in touch with him. Who do you live with currently?
My husband and daughter.
Just one daughter?
Mhm.
You did mention that there were some concerns with parenting, and you mentioned some concerns with family conflicts, right? Okay. And some abuse, as you described it. Okay. Any other stressors in your family right now that you think this is affecting my family? What would you tell me?
I would say, I mean, I don't have evidence of him cheating on me, but I think that he is.
You did mention that you have had issues sleeping. When did that start?
I would say maybe a month ago.
Okay. What changed a month ago?
Him drinking more and being more verbally abusive.
Any issues with, say, for example, separation or divorce, anything that you think could be present? So let's talk a little bit about your education, right? So you did mention that you attended college, right? Did you graduate college?
I did.
Okay, what's your degree?
Bachelor's of Science in Nursing.
Nursing. Is that your current trade? Okay. We're also going to talk about work, so you can tell me all about the coworkers you don't like, so we can talk about that for sure.
Okay.
All right. How satisfied were you in school, both grade school and college? What would you tell me?
I was satisfied.
Okay. Any issues in schools? For example, getting into fights or
No.
timeouts, grades, anything whatsoever?
I've
So
always been good and I've always had good grades.
I think
I'm on the
you,
dean's list.
okay, good deal. I do hear this common theme about being good, right? For example, you mentioned earlier trying to be good and somewhat of a perfectionist, and I see that again with your schooling. So that's a common theme that I've seen so far. Did you need any sort of, say, for example, accommodations in school? If I were to ask you, what would stop you from coming to therapy and actually doing sessions with me, what would that be? Anything cultural, religious, motivation, physical, anything that you think this would stop me from seeing her? What do you think?
If he found out I'm taking hospital anymore.
Okay. How do you think he would find out?
I don't know, maybe if he saw like an insurance statement or something.
Okay. Well, the thing about that is whenever we process our billing, we can have an office manager know that to not mail came directly to
Okay,
you,
that would-
and
yeah,
to
that would be
change
great.
that address or make a note to make sure that it looks confidential.
But is it wrong when I'm keeping this from him?
Well, the thing about right or wrong, I like to think about what is in your best interest, right? So if you consider that this is the best thing that you can do for yourself right now, that is a very personal decision. And I usually like to go with, okay, what is something that I need to reach my goals?
I just feel like it's a lie and like I'm keeping him from, like it's a lie in front to my husband's gonna harm my marriage more. But I do think the counseling's good.
Well, like I said, unfortunately, he's not here, right, to address that situation. If later on, for example, if you think that's something you would like to include later, say for example, in a couple session or something along those lines, if later on in the future, and if you're ready and I think it's beneficial for your treatment, then of course we can modify a treatment plan if that's what you wish to do. Okay. And you did say you have a child. Have you had any other children?
No.
What about stepchildren?
I had a miscarriage.
Okay, tell me what happened.
I was 9 weeks pregnant and I just started bleeding heavily a lot, major cramping. So it passed naturally, so I didn't have to have it.
You did say that you work out, right? You did say that you work out to cope. What else do you do to cope? Say, for example, with the concerns at home or anxiety. Say, for instance, you listen to music, you play with your pets, you write, you play video games, anything that you do to cope.
I like to take long showers and baths. That's,
Okay.
and play with my daughter.
Okay. What about anything else that doesn't involve another person? So, for example, not your daughter.
I don't.
Okay. Well, something you're going to learn here is that many of our coping mechanisms don't involve another person. And the reason for that is because if the other person is not available, then what are we to do, right? So a lot of the things that you're going to learn here, that's something you're interested in, is coping mechanisms, right? And how to exploit them. Tell me about something that you say, you know what, I have that going on for me. So for example, academically, behavior, communication, your family, say for example, any other things that you think, you know what, I have that going for me.
Academically,
Okay,
I like my job. I work 2 days a week
okay,
right now. I'm so blessed that I get to be with my daughter.
okay. For example, let's think about motivation. Are you motivated to come to therapy, or do you think this is not going to work out for you in other sessions?
I'm just nervous they will cut out,
Okay,
but otherwise I'm motivated.
okay. Any support in your community? So for example, any clubs, any societies,
No.
church, anything like that? Okay. Let's talk a little bit about your criminal history. So for example, have you ever been arrested, incarcerated, jail, prison, anything like that? And as a juvenile. Okay. Do you identify with any sort of religion or spiritual belief?
I believe in God, but I don't go to church.
Okay. Is that by choice, or what would you tell me?
Yeah, I mean, I just feel like it's full of hypocrites, so I just want that.
Okay. Do you identify as Hispanic, Caucasian, mixed, anything whatsoever?
I'm just like,
Okay. Any sort of cultural issues. So for example, you're homesick, you miss your home state. Say, for instance, you've been discriminated against because of any concern. What would you tell me? Okay. And do you have any sort of identifications? For example, you identify as straight, gay, bisexual, transgender.
straight.
Okay, good deal. Right. And you did say you work as a nurse and you work full time. Okay.
No, I work
Part
2 days.
Okay, thank you. And how long have you been working as a nurse?
8 years.
Okay, so it's been a couple years now. It's good. And then my dad is also a nurse. He's a psychiatric nurse. Actually,
Trauma.
you do
Trauma
trauma.
nurse.
Okay, but that must be pretty an interesting field, but also really challenging. Let's talk a little bit about your financial status. Do you feel comfortable? Are you at risk of being homeless? Do you have any concerns? You get by? It's really difficult to get by. What would you tell me?
I feel comfortable. I worked as a travel nurse.
Okay.
And made pretty good money before I had my daughter, and so I was able to save a good bit.
And you were born female? Okay. And you currently identify as a male, female, non-binary? Okay. Let's talk a little bit about your home environment. Do you live at a rented house, a rented home, your own home, a trailer? What would you tell me?
We live in a townhome.
Okay. Is it in good shape?
Yes.
Are you at any risk at that home? So for example, the building is not safe, the neighborhood is not safe, so it's a safe environment for you? Okay. Good deal. Okay. What do you do for fun?
Hang out with my daughter, exercise.
Are you prior military? Let me ask you, so do you have any concerns regarding any substance use or alcohol, anything like that?
For me,
Mm-hmm.
no.
Okay. Let's talk a little bit about any history of trauma or abuse. Is there anything you would consider abusive or traumatic in your past?
No, not abusive, but like I said, I think just hearing my mom and dad constantly fight is pretty traumatic for me. I remember used to like lay in bed and hear them fighting. I would just like want to close my ears and not still remember that.
When do you normally remember that feeling?
Maybe when I hear loud noises or when my husband's yelling at me. Like that.
Really sorry. But the good thing is you're in a spot where I can provide support for you. Let's talk a little bit about your developmental history. So to your knowledge, was the pregnancy with the mother carrying you in the womb, were there any complications, any concerns, C-section, anything like that?
She had gestational diabetes.
Okay.
I think they had to induce early because of that.
And how was that birth? Was it complicated?
I don't think. I think she had me naturally, but like I said, she was induced. So
Did you have any issues or any concerns when you were growing up to your knowledge? So for example, you took some time to learn how to be potty trained. Did it take you a while to learn how to walk or how to dress yourself?
no, I think I did it. They told me I did everything pretty early.
Okay, so no history of that. What about your own births, for example, with your daughter? Was it complicated? Was it normal? What
No,
would you
hers
tell?
was so easy.
Okay,
Except for I was sick like the whole first trimester.
okay. When you say sick, what do you mean?
I vomited like all day, every day for 12 weeks.
Other than that, any other concerns with pregnancy other than
The first miscarriage.
Right. Okay.
And we don't know why that happened.
Did you know you were pregnant?
Mhm.
Let's talk a little bit about family history. So I want you to think about any family member, your cousins, uncles, aunts, mom, dad, brothers and sisters, and anybody else, grandfather, your own daughter, anybody who's related to you by blood. Is there any history of substance abuse or mental illness, neurological disorders, anything whatsoever? What would you tell me?
I think depression. Because I think my mom was depressed.
Okay. You receive a formal diagnosis from that, or do you
No,
suspect you
I
have depression?
suspected. And then my uncle had he was a drug addict.
What type of substance do you know he uses or suspect he uses?
I think it was much.
Did he ever receive any treatment for that?
Yeah, he was in and out of treatment.
Okay. What about mom? Did mom ever receive any treatment? Anybody else that you think this is some history?
I don't know about my dad's side really.
Okay. Now, let's think about not only family members, but let's think about someone that's closely related to you. Let's think about any person close to your family member that has attempted or completed suicide. What would you tell me?
I had a coworker's brother commit suicide, and he was a veteran.
Okay. Were you close to him? What did you think about his suicide?
But I'm close to her,
Right.
and so I went to the funeral and supported her.
What did you think about the suicide? What impact did that have?
It's very sad. I hate it. I hate it for our veterans. I hate that they don't get the support they need.
Do you have any history of self-harm? So for example, punching yourself, hitting yourself, burning yourself, cutting yourself, anything whatsoever. Okay, what about suicide attempts or suicidal ideation?
No.
Let's talk a little bit about thoughts of wishing to die. So for example, not necessarily suicide, but say, if I don't wake up tomorrow and I just wake up dead, as some people would say, that would be great. Or if I have a car accident and I die, well, then I die. What are your thoughts about that? Any thoughts that are similar to that?
I don't think so. I mean, no, because I have my daughter, and that's my will to live.
If I were to ask you, what is your goal for therapy? What do you wish to gain? Or what do you wish to lose in therapy? What would you tell me?
I mean, really, I just want my marriage to work. I want to be happier in my marriage.
Okay, what does it mean to be happier?
And I want to be happier with myself.
Okay, so tell me what it means to be happier in your marriage.
To feel safe.
Okay.
It's not that I feel really physically unsafe. It just feels like, I never know what I'm going to get. And so I'm always kind of on edge.
Tell me what it means to be happy for yourself.
To not feel insecure, to feel confident.
Tell me about insecurities presenting to you.
I feel inadequate because, like I said, I'm overweight and feel like he was looking for another woman because I'm not attractive or good enough.
Are there any questions that you may have for me? We'll say, for example, anything that you think, oh, this is important, maybe I need to mention that, anything whatsoever. Well, if there's anything that comes up, just let me know in our next session, okay? And we're going to get you scheduled. And I'm really happy that you came in and visit today. Like I said, this is the hardest step, and we're done with the hardest step. So thank you very much for allowing me to ask these questions to you. This is my good side. I kid. Entitled to confidentiality, which means that I cannot have your phone on. Let me do that again. It affects our current state, whether it be our symptoms, how we cope. It can also there it is. Who's down here?
My mom lived down here. And drinking more.
Oh. What do you think?